of Nakuru on their opinions in terms of country preparedness to combat COVID-19. Joanna Tin, good morning.
Good morning to you, Brenda, and good to see you. Well, it is a very good morning here in Nakuru. Well, the situation here in terms of COVID-19 is actually improving, but remember, more tests are being done and some have been confirmed positive. But well, today the governor will be visiting the COVID-19 testing center at the Nakuru Level 5 hospital annex, where he will be inspecting to see if we are ready to actually start mass testing here in Nakuru. But allow me to speak to a resident here who is going to give us a clearer picture, or rather tell us if he feels that the county is well prepared to handle COVID-19. Thank you, sir, for joining us. Speak to us about the county preparedness. Do you think that we are ready as Nakuru County?
Well, my name is Asande Baresia, and from where I'm seated, I don't think if we are much ready prepared for COVID-19, because the governor has never come out to give direction. We're just hearing achievement is going to inspect. We want active governors, not show-up governors. Yeah? And we are so much concentrating with COVID-19 cases than other diseases that are costing people. Kenyans are beyond and more than COVID-19. We need the input of the counties into our system, not harassing system in the name of COVID-19. Yeah.
You mentioned that probably we are not prepared, in your opinion. What do you say so?
A leader comes out and gives direction. In Nakuru, we have never seen a governor coming out, talking to its people, consoling its people. Instead, what we are seeing is county MPs walking around trying to make their names, give out food for some of the most vulnerable, but once in a while. But the governor is nowhere to be seen completely. We are only going to see him in the media inspecting the COVID-19, and then he's gone. He cannot be accessed over other issues.
That's your opinion. If you are to speak to him directly, what would you tell him? Governor,
you are elected by the people. People want to see more of you, not only COVID-19. There are people who have been submerged, their homes have been submerged with water. They want to see you there as their governor. There are people who are sick not only from the COVID-19. They generally want to see you improving their health, not closing health sector or opening COVID-19. We want you to open clinics, things that will affect the lives of a common man. Calm down, feed them, you are their father. The county cannot run just like that. People are quiet, watching God to come out. Yeah? And you are there seated watching what is going on in my county. Mr. Governor, we need to see more of you. We have not seen anything from you until now. We are seeing COVID-19 inspection. Governor is coming.
Well, there have been mentions about, or rather we've seen the isolation centers as well as the ventilators being bought by the county government. Do you think it's enough to prevent, or rather to help those who are suffering from COVID-19?
One, I don't want to talk much about isolation center because so far, so good. COVID is not much in Nakuru, not unless you bring it. Isolation centers are there, but God has taken good care of Kenyans. Yeah? What we are seeing about isolation center, people are being harassed in one or the other in the name of quarantine. Be genuine to Kenyans. Tell Kenyans what are these isolation centers for. Yeah? We are seeing, if we are to fight corona, and our cells are full of young men arrested in the name, one or the other, if they are caught up with the curfews, they are caught up with the mask thing. Please, let us be genuine fighting corona, if we are fighting corona. Yeah? And the other day, the CS said very well that some cases we will have to tackle them from home because we don't have enough centers. So I cannot say that Nakuru we are okay with our centers when the CS is talking something else. The CS Kagwe has given a very good direction that we might be forced to take our people home for quarantine, which is okay for me.
You mentioned that home care will be a better option, but do you think people in areas like Kivumbini and Bomondeni areas will be able to manage, considering the fact that majority of them live in single rooms?
One, when you hear there is a home care, you must know that you are handling someone who is sick, and you have to be there for them. Make sure you give them proper care as per the directives. Because Kivumbini, if you lock up Kivumbini, you have brought a lot of problems, because those people are very poor people. They survive from hand to mouth. So lock up Kivumbini at people, there is corona there. How will they survive? And there's no provision from the government of Kenya completely. It's just a story we are hearing, people are given food. We don't see that completely. What we see is politicians making names for 2022.
Well, that is the opinion of a resident of Nakuru here. He's saying that the government should actually step up and ensure that those who are suffering from COVID-19 are well protected, as well as their families, which many of those who live in the slum areas cannot afford food, and some have lost their jobs. So, well, they're saying that the government should actually step up and provide for them the basics. And for now, Brenda, it's back to you in studio.
Thank you, Joan Latin, for that. From the Rift Valley region, we head straight to the Coast region.